Wisconsin is now being seen as a COVID-19 hotspot in the country, according to UW Health. News 8 Now's Isabella Hulsizer explains how health experts expect a grim outcome if Wisconsinites don't change their behavior.
We saw it begin in other states with big cities, but now it's creeping closer to home.
We started seeing increases in counties that we would consider more rural counties or counties without as much population. And that was a bit of change for the state, whereby it wasn't just a problem for our more urban areas. It's a problem for the whole state at this point.
COVID-19 case counts have broken record numbers in Wisconsin, where over the weekend 2,817 new cases in one day were reported by the Wisconsin Health Department.
Our behaviors have to be what's driving this spike in cases.
Pothoff attributes this behavior to not wearing masks, washing hands, or social distancing.
In Wisconsin, you're seeing these cases crop up all across the board. So, the number of cases in all these different age groups are going up.
We can see this in La Crosse County, where a majority of cases are in the 20 to 29 age group. But 10% of the data is also from those ages 80 and above.
I might not get as sick from COVID-19, doesn't mean that the next person I interact with doesn't.
The La Crosse County Health Department's case data shows that this past week, 100% of the origin of those contracting the virus were from a close contact. These increases are being seen in the healthcare community.
I've seen an uptick in the number of cases admitted. So far, it's been in the single digits. The ICU is slowly starting to tick up a little bit.
We're going to see more people hospitalized, and then unfortunately, at some point, we'll see more deaths.
Both La Crosse healthcare systems report their hospitals still have the capacity for COVID-19 patients, but UW Health says those systems may become stressed.
All of those plans have an endpoint, and there is no hospital with infinite capacity. And that's a real worry for those of us in healthcare, because the last thing we want to do is to provide anything less than grade A medical care to the citizens of our state.
In La Crosse, Isabella Hulsizer, News 8 Now.
The health experts say the lag in COVID-19 symptoms are usually between 7 and 10 days, and they say we can expect to see an increase in positive cases within the coming weeks.